Yeah, so I'll take it from the side of the hospital.
Hmm.
The hospital has been working throughout, and we are 24/7, 7 days a week. So, in the lockdown, it was our emergency services, and it was our inpatient care that we were running. And with regards to our outpatient facilities, that's where we had to actually shut down a number of clinics, especially high-risk areas like ENT, ear, nose, and throat, dentistry. There were certain specialties that we had to actually stop. But then this is where innovation comes in looking at how then do you continue your services, because this is going to continue for a long time.
But these are some of the areas that you get a lot of patients and you're able to get the money to pay your staff. So
Yeah.
how has it worked?
So it's not been easy, and I'll say that I speak not just on behalf of Niaho, but for every other private sector player. And there's a number. They have the bigger facilities like ours, which do inpatient, but you also have smaller facilities, which are clinics that do outpatient. And so, in the private sector, I see there's no difference. It's just that you are closer to the patient. So the patient naturally is going to give you value in terms of revenue if you meet their needs. So whereby you don't have patients, you don't get revenue. And if you don't get revenue, you can't pay your staff, but you also can't pay your dependents. So that is your suppliers, your value chain, and there's so many other businesses that are dependent on yours. And so there's a ripple effect, and that's not just the business side. If you don't have healthcare workers who are putting themselves in the front line, they have to be protected. So now all of a sudden you have a new cost. Your new cost is PPE. So your new cost is now trying to source protective equipment for your frontline healthcare workers, but now the costs are going up, double, triple, and there's a global supply chain shortage. So even getting access, you have to import them in. So now your costs go so high up that actually it becomes very difficult to even do something at a marginal loss. And this is why you need support in these times. So for certain companies who are able to get other facilities, get financing very quickly from other places, literally some people have to sell their assets, sell equipment or sell things to be able to make cash to pay for things which are due by the end of the month. But then others are bigger who can get maybe some bank financing. But even right now, which banks are lending so quickly that they can meet the immediate need. And then lastly, you're talking about your obligations to the government, because every private sector is also a business, and government gets its revenue from taxes. So whereby you now have small businesses which are no longer in a position to pay their taxes or to pay electricity or water. And I know that there's some initiatives the government has done which is helpful, but not in the long term. So these are the constraints that a private hospital or clinic will be having and need to be resolved as soon as possible.
Right. So you mentioned PPE costs, you mentioned access to financing, you mentioned taxes, and then you made an interesting statement that what government has done is helpful, but not in the long term. What does that mean? We saw the electricity and water. Is it that because it's just 3 months, it may not make much of a difference in the long run?
So, what I value most about our government, and I think that we have to commend the government where they've done really amazing things. I think that they've shut down the borders, they've put in public health measures, and those are all the right decisions. Now, execution is different. You can make the right decisions, but if it's not well executed, then it does not have the full impact it was meant to have. So, when you look at the directives, the directives are commendable for 3 months, yet it did not trickle down to the bottom line, to the bottom of the pyramid, meaning that those who are at the very forefront, who are maybe not in the who are not in the Ghana Health Service or on the payroll, how was that done? How was that translated to someone who is running a clinic in a very remote area? And I think these are the real challenges. Even in America, you're seeing that you can have government initiatives, but if they don't translate down to the ground, it doesn't mean anything. And so we haven't seen that full execution. And I think that is where we need the government to actually go down and change their way of working, because now you have to be very reflective, very agile, and it requires you to change the way you get data. So if hospitals are not known to districts, and if districts are not getting the right information, then you have this problem. And there's a big problem now in that the lack of data. Listening to you earlier, it's just even looking at testing. Not every facility is testing, and not every facility is in the hot zone. So as Nyaho, we are in the hot zone, whereby we have been testing, we've been treating. And that's really the challenge, is that you cannot also take every hospital to be the same, because some hospitals will be overburdened with these cases, whilst others won't be. So you need a lot of data, and you need to be very intentional in how you execute.
Let's go back a bit and pick one of the things that you mentioned, that is PPE.
Sure.
We understand the cost has gone through the roof.
Yeah.
Explain this for us.
So when this started in China, I think that China, as a manufacturing and supply chain behemoth, the world was so dependent on China that the lockdown in China affected the global supply chain. Now, as COVID moved to Europe and to America, what you see is that, first of all, the lockdown meant there was no manufacturing, no production. And so now that you don't have a lot of supply, but the demand has increased, you really have a catch-22, whereby, well, it's going to cost a lot, and even if you have some, you don't have a lot. You just have a few to last you a few days. So I think this is where the global supply chain challenges has meant that costs in Ghana are even more expensive, because you also have to import. And this is the challenge, that when your borders are closed, you need to actually pay a lot more to do the simple things. And so it comes back to the cost structure. I would like to also say that there's so many dependencies. So if you look at, we're talking about PPEs, but PPEs are a big, broad category. So it's not everything. You can have masks, but you also need face shields, you need gloves, and all of them are made from different material. So also, if your industry is not making certain things, you will find that you don't have the full protection, and it does not matter if you have some protection. You need the full protection to protect your healthcare workers, because they are the ones who are going to be treating patients. And if they fall sick, if they die, then you don't have any ability to treat patients. So the priority is PPEs first of all.
We've seen government go into supporting the production of some of these PPEs. Earlier, you were mentioning how some of the policies sound good, but you are not seeing the trickle-down effect. Is it affecting the PPE production as well?
Well, I think this is the time that government can really realize the full benefit of private-public partnerships. Because, whereby the private sector were created out of a need. No person goes into a business if there is no need. So if you talk about healthcare, well, Ghana's healthcare system requires a lot of support, and the private healthcare sector accounts for almost 40 to 60%. Now, it's hard to know the numbers, but at least half of all healthcare is done by private sector. The same thing happens in other industries. So whereby private sector has to be very agile and very reflexive, that is the opportunity to leverage private sector players who can move quicker than what would happen in the public sector. But the public sector obviously can coordinate to ensure that there's equity for all Ghanaians. And so you want to make sure that you're using the people and the skills which are working well, and put as much firepower behind them for the benefit of the common good. So I've seen this work in PPEs. One of my colleagues who works in manufacturing, Linda, she's the CEO of Cadling Fashions, and I think you saw the vice president did a tour of a number of different facilities. Now, repurposing private sectors like that, who have the skill, but letting them start to manufacture and produce for local use, I think this is the right way to go. So I think that's what I would say, that the opportunity for Ghana is to fully realize the full benefit of the public-private partnership in this time.
Now, I'm asking this question about PPE because we are seeing them being manufactured, but we are still getting a word from frontline workers that we are not getting enough of them. So from where you sit as the head of a private facility, you are from a community of private facilities. From manufacturing to supply, Is that link there, or you're not seeing it so well?
Yeah, so I think, again, this is where that you can have, like any system that is complex, if it's not well coordinated, you will have a limiting step. You'll have bottlenecks. And in this case, you do. I would say that the reality on the ground is that currently we as a hospital are still sourcing our own PPEs. In the beginning of this crisis, January, February, March, when we were testing, we used our corporate social responsibility and we're doing it for free. We realized that actually as we started picking up the first cases, there was no way. We were running out of PPE for our own staff, and we had to now start purchasing from so many different sources. So at the end of the day, right now, we still haven't received PPE that can actually make a difference for our facility. Now, I think that there are people who are trying their best, but when you are a cog in a wheel, or when you are one step of a long process, if the whole process is not coordinated, you'll find a lot of people are frustrated. And I'll say my colleagues in the Ghana Health Service, in the Ministry of Health, who are doing their best, sometimes are restricted because it's not so much dependent on what they are doing, it's what the person down the line is doing. So I think that's where we need to take a step back and just think of ourselves like any well-oiled system. If all the steps can be matched, called out, and executed, I think that it will reach the bottom. And my concern is not even for bigger facilities like ours. Like I will say that in Yahoo, we have a system, we have people, and our people are amazing. We've invested over 50 years. But I'm talking about that sole proprietor who actually is he's not only a doctor, but he's also managing his clinic. How is he going to have the time to go and do all of the calls, all of the sourcing, at the same time treat his own patients?
I'm curious, as private institutions, have you engaged government? Has government made any commitments to you? Because I will make this confession. When I was preparing for the show yesterday, it was like an eye-opener for me. Like, wow, private institutions also need PPEs from government. And it was after engaging you and some of your colleagues that I realized how important it is. So have you made this known to government? And has government committed to supplying you any of these?
So I think now is the time that there's a giant that needs to wake up. It's a sleeping giant. And that is that when I talked about the statistics, if you say minimum 40% of all healthcare is done by private, a mixture of people. The problem is that it's fragmented in that all of these institutions are individual, are separate. And so the coordinated approach is extremely difficult in the private sector. You have the Society of Private Medical and Dental Practitioners, which is a society that actually is speaking on behalf, but they are speaking on behalf of a certain group, because you cannot be all things to all men. And so now is the time that you are seeing bigger facilities which are now beginning to coordinate and speak together. So right now, I say a number of bigger facilities have started talking about how do we actually come with a united front so that we can be listened to. Because if we go individually, you're just one entity. And if we go together, we can actually start to make our voices heard. So this is why, for me, I'm really a champion of the role of private sector, because I think that even Yahoo has never been able to do anything on its own. We have survived for 50 years because of partnership, because of collaboration, and I think that's whereby we are the only institution that's 50 years. In Ghana, whereby 62 years independence, I think that feat is not without the work of having to work with people who are different from you. So this is the lesson that we need to learn for the private-public partnership, that yes, we are different. Everyone has different strengths. Now is the time to get our egos out of the way, be humble enough to say that some people are doing certain things well. Who are they? Some people have other strengths. Let's bring all these competencies into the table and let's get it working. So yes, I think now is the time that we as a group have to get our act into order and start speaking on behalf of our clients.
Okay. Quick one on this one. Will your staff enjoy the government stimulus package?
So, I mean, we know the intention was for all frontline healthcare workers. But as I mentioned, who is a frontline health worker? And I think that's where the last few weeks, a lot of the conversations, discussions have been about defining who the frontline healthcare workers are. They are not just in the Ghana Health Service. They are also in the private. And so, just this morning, I know that there are people who are in the ministry who've been having these conversations so that it can actually be a holistic approach. But the reality is that Ghana Health Service is an operator, is an employer, and they have their own mechanisms and their own payroll. So when you say 50% allowance in the Ghana Health Service, it means one thing. How does that translate to a private entity that has its own different way of working? And we don't know that yet. We haven't had the conversation yet. But we know that there's an attempt at this. People are trying to clarify, but we need to do it quickly. Because I'll tell you that our Yahoo staff are they've been doing so many shifts, so many hours, and they feel so demoralized. Myself and my exec team, all the time we talk about that this is a calling, this is a mission, that we're not just coming to work, we're coming to save lives. And so everyone has been working weekends and nights to really ensure that we can lift up the morale of our frontline. So we are doing free lunches. We're trying to ensure that we help with transport. And especially for the emergency and our critical care staff, we are saying that what can we do to help? So as much as we can do, we will do. But on the business side, it means that we also have to make some tough calls. We cannot do everything. We need to start cutting some things. We need to start working very lean. And this is whereby there's a compromise. And this is a challenge, I think, that every organization, there will be a compromise. But when it comes to healthcare, you cannot compromise healthcare. And we're coming into the wet season. So into the wet season, the public health system is already overwhelmed. That's where private sector came up to support the public sector.
Okay.
But in the wet season with malaria, with respiratory illnesses, what will happen if you have that and then we are not ready for this crisis?
Now, I just wanted to get this on the tax element. So there are those who may have to see an increase in salaries. They are paid by Ghana Health Service. With that, some challenges may come. But what about the taxes that are going to be removed? Will we see those monies being returned to doctors and nurses who work in private facilities?
Well, again, I mean, I cannot speak on behalf of the ministry or the Ghana Revenue Authorities, but what I can say is that whatever has been done, we have a solution for 3 months. Now, realistically, we have a number of scenarios. Worst case scenario, middle, low. Our reality is that this is not going to go on for 3 months and end. This is going to go on at least till the end of the year, because like any peak, it goes up and it comes down. So I think that we have more need for conversations, and it's going to be a different approach for different entities. And we need to now talk about planning for July, August, September. So when it comes to taxes, we have to be very prudent that anything that we have, we need to, like a wise man, start preparing for the end of the year now.
So would you have to save some of these monies that would have been in taxes and say you're going to use it for the end of the year, or how is it going to work?
So we're looking at every single aspect of our revenue streams and our cost streams. On the revenue side, we have to pivot. We have to find new ways of working, and we have to make sure we meet the need. The need has changed, and so at the end of the day, a patient, if they see value, will pay for that value. That's it. And so if you're not giving good value, then patients won't come to you. In the private sector, that is as simple as that. So we need to meet the need of our clients first and foremost, and that is top of mind. But the second is also on cost. Our staff are also human beings and have families. So we also provide medical care for not only our staff, but their beneficiaries, up to 4 children. Now, if we don't manage our costs well, we won't be able to offer that free health care. And that becomes my concern on the cost side. So that's why I'm saying that we do need to become lean. We need to shrink back on even where people can shrink back on their own salaries. Like for myself, this is definitely the consideration about cutting back and making sure that everyone is equitable. So that's where, at the very least, let's try and maintain our staff, but it means that we all need to come lean. We need to let go of some of our salary. And we have to have this conversation in partnership. So whereby some can do more, this is the conversations that our HR department and our directors are having to say, what can we cut back? Because even if we have something, let's say June, we are able to say that we didn't have to pay electricity. The reality is that our revenue drop is more than half of the revenue drop is significant, such that even electricity, water, tax incentives is not enough. And that's a challenge. Every business is going to go through this, but This is the call to action for leadership. In the midst of the obstacle, where is the solution? Where are the new ideas? And so we are not looking and becoming demoralized. We are finding new ways of working.
Okay. Our guest this morning is Dr. Elikim Tamaklo. He heads Nyaho Medical Center. And I can say with confidence that he's not just speaking for himself, but for the private medical facilities across the country, which see up to 40 to 60% of the patients that go to the hospital. We'll take a few messages. When we come, I've taken a few notes. Your workers, your patients, and the pandemic generally. How have they been affected? What must we do going forward? You talked about how it's time to look at the solution. What is that solution? We'll explore that when we come back. But coming up a bit later on the Super Morning Show.
There's no way we won't have a new register. You must understand this.
Those who think that they can be dealing with one hand on trying to take unfair advantage of the elections and the other hand pretending to be putting the health first, in the end they will suffer the consequence.
Winston tells us how coronavirus has affected partisan politics. It's a conversation you don't want to miss. Stay with us.
What would you do if you have the choice to do anything in life? Build your dream house, take very good care of your family, and plan for a comfortable retirement. Plan a befitting funeral for your loved ones when they depart. How would you live if you knew there was a friend waiting to support you on all of your life's choices?
You have such a friend in Glyco Life Insurance. Glyco Life has all the plans to meet your life's needs. Your child's education, your life savings, your mortgage, funerals, redundancy, and your retirement, and takes the burden off your shoulders. So go ahead and live life to the fullest today with Glyco Life Insurance Plans. And remember that all our policies are hedged against inflation. Talk to Glyco Life on 0302 218 500 or 246 142. Also visit our website at www.glycolife.com or any of our branches nationwide for more information.
Glyco Life, we cushion you for life.
Glyco, we cushion you for life.
Accidents do happen. It could be a motor accident, a sudden heart attack, or even a stroke, or any other health emergency. The first steps you take are very critical. Should you be involved in or witness an accident, call 112 for the fastest ambulance response. With over 300 well-equipped ambulances all over Ghana, you are assured of the fastest response to your emergency calls. Call 112 during critical health emergencies and save your life and that of your family and loved ones. 112, help will come. 112, we are safe. Avoid prank calls as they can lead to loss of life of persons in actual need of help. Be a responsible citizen.
Every child needs to learn and play. That's why I give my kids Go TV, the best choice for kiddie edutainment. With lots of fun and educative channels for all ages like Da Vinci, PBS Kids, Cartoon Network, Nickelodeon, Jam Jam, and Disney Junior. Learning the fun way never stops. So, mommies and daddies, keep the children playing and learning whilst at home. For sales and customer service, SMS Go TV to 1731. Go TV. Live it. Love it.
UMB was established in 1972 as the premier bank for the corporate and private sector in Ghana. From our very beginning, as the only Ghanaian bank serving all categories of businesses, we set a standard for excellence and innovation over the past 45 years. We've built a financially healthy and strong bank, demonstrated our commitment to our customers and to growing businesses, and exhibited originality and innovation at every turn. At UMB, our focus is built around people, service, products, and technology. These are the key to our present success and our future triumphs. At UMB, we're poised to make a difference not only with our customers, but also in the banking industry. We invite you to share in our future. Our future starts now with you.
you graduate. Oh. Next thing is some scholarship for your next level.
That be long thing. Today bring this, next day bring that. Koha, braha. You know I can't stand that. But everything is fast. I can't even wait for food. That's why I'm always eating Indomie. No long thing.
It's not the case anymore. Everything is digital now. Simply visit scholarshipgh.com to apply for a scholarship from the Scholarship Secretariat.
I can apply on there.
Fast.
Submit all my documents.
Fast.
Like my Indomie.
Just visit scholarshipgh.com from 1st April 2020 and you could be on your way to your dream school.
6 minutes till we hit the top of the hour, 9 a.m. This is the Super Morning Show on Joy 99.7 FM. Our guest in studio is Dr. Elikem Tamaklo. He is the CEO of Nyaho Medical Center. We're talking about what COVID-19 means for private hospitals. We've really come to understand that, look, these are guys who are at the front line, just like any of the public hospitals that we see. But they've been hit twice. Their businesses and their social services. So some tough decisions have had to be made. For instance, even this tax rebate for health workers may be difficult to trickle down to the workers. They're getting into a couple more of the issues, then we wrap up. Remember, we have that conversation about how coronavirus is affecting politics in Ghana. These are not normal times. In moments like this, we draw our loved ones closer, discover new things, and do better. As I figure out how to entertain your energetic kids, collaborate on never-ending work from home, or hang out with friends together but apart, remember, the most important insurance premium is to ensure your family's safety and stay home. Whole Out Life Assurance will be there when you need us. Just call 0302-799-788. We've got you covered. Now, GCB Bank Limited informs customers and members of the public that all branches of the bank across the country have resumed banking business. These include branches in Accra, Tema, and Kumasi areas, which were temporarily closed down due to the lockdown 3 weeks ago. Our banking hours remain 9 a.m. to 3 p.m. from Monday to Friday. There will be no Saturday banking until further notice. We encourage you to use our alternate channels, including G-Money, for all your banking transactions. Please observe COVID-19 preventive protocols, hand washing, social distancing, sanitizing, wearing of nose or face masks, and other hygienic practices. GCB, your bank for life. Right, let's get back to talking to our guests. So, like I promised before we left Dr. Tamaklo for that brief batch of messages, we want to look at specifically how it's affecting us in terms of costs. So, for instance, how much more are we paying out? I know that some of these thermometers, no-contact thermometers, have jumped from 250 cedis each to about 1,800 cedis each. What does that mean for your business? How much more money are you spending?
Well, thank you for the question. I think, the reality is that at least we are paying double or sometimes triple for a number of things which should not be the case. And these are things which are already in stock. So when you have items already in stock, these are things that should not go so drastically above because you're not buying them again. And I think that's where there needs to be a protection in terms of value for money, for cost of goods, especially for critical care goods. So I think that's the first thing. Not all things are equal. But the things which are being imported in, it's actually a representation of what's happening globally. So if you can only bring in an item at double the price or even sometimes 5 times the price, then yes, for you to actually sell, it's going to be really difficult to sell it at anything less than 5 times the price. And so looking at some of the things that you talked about in terms of guns, thermometer guns, which are used for non-contact, the reality is that we're not manufacturing that locally. We have to import it, and they run out. And so we have this catch-22. So I think that one of the solutions is about protecting the end user by restricting the ability to price beyond a certain amount.
You want governments to bring in price control measures?
And in a time of crisis, yes, you need that. Because you need to not just think about your sustainability, and definitely every business has to be sustainable, but it cannot be to take advantage of a crisis. And I think that one of the things that you look for, obviously value for money is one thing, but definitely you have to look for the wider population and supporting their ability to protect themselves. So if something like a thermometer gun is used for protection, you have to put some sort of governance on that.
Now, supply of PPE. Are your workers getting PPE from governments? Do you think private institutions should be included?
Definitely, you're only as strong as your weakest link. So when we say frontline healthcare workers, it is not government or private. It is anyone who is at the front line. And we have to kind of be real. It's a war. And when you look at a war, if you have a gap in your front line in the war, definitely you're going to have a prevention. The virus is going to continue to spread. So you need to actually think of the front line as a front line and ensure that any place that is in a hot zone, whether private or public, they need to be given PPEs. Now, in our case, we haven't. The little that we have, and we have been working with our district, and I know that the district is also constrained, because whereby the district has to give out to many people, sometimes private healthcare is seen as, oh, you don't have a need, so you are kind of last in terms of consideration. But in this particular case, when you are a hospital or a clinic in a hot zone, very different. You need to ensure that they have as much PPE as they need, because if they don't do the right thing, the virus will continue. So the public health response will be, everyone will be working so hard, but for nothing. And we cannot allow that to happen. It will cost us too much in Ghana.
How many of your workers may you have to lay off?
Well, the reality is that we employ over 300, well, in terms of, if you include part-time, over 400 people. Full-time is about 330. But then also, when you talk about our contract workers, they're over 500. Now, one of my biggest nightmares is about, as much as possible, we don't want to lay off. The reality is that it's not just about what will be the impact for themselves. The reality is that, well, we are going to get an increased demand in healthcare. When that increased demand comes for emergency services, where are you going to get the people? Because we have a limited resource in Ghana. We don't have a lot of nurses. We don't have a lot of doctors. Comparative to other West African countries or even countries around the world, our doctor-to-patient or nurse-to-patient ratio is extremely low. And so you cannot let go of healthcare workers. So we are so committed to finding other ways. As I mentioned before, can we actually all restrict, can we all take a percentage decrease so that we can all continue to come to work? Obviously, we've looked at leave. High-risk healthcare workers have been reapportioned to different places, and people who can take leave should take leave. But we need to try and retain our healthcare workers. And it doesn't help. It does not help when the government says, we're going to open up and we're going to recruit any price. We're going to recruit more healthcare workers. Because that means they're taking people who are working in the private sector and they're taking them to the public sector. Now, obviously, there's this whole conversation of who is doing what. And I think that public-private partnerships matter. So I am not trying to say any one party deserves more. I'm saying that the government or the Ministry of Health, who's responsible for coordinating the response, needs to look at how do we strengthen the existing facilities. How do we ensure that whatever they have, they can do the essential healthcare services well, so that we can ensure that we are not removing one problem, but in the process of trying to tackle COVID-19, we are creating another problem for that community.
Okay.
Because that is the reality of what happens.
Now, for some of your workers, they may not like the idea that, for instance, because you don't want to lay people off, you're going to have to cut back on the reliefs that come to them. Because some may, for instance, argue that, look, the tax exemptions were money that government were taking and you're not paying anymore. So why don't you give it to the worker? Here you are saying, I need to keep it to save your job. What would you say to those brackets of people?
Well, I mean, let me be clear. I mean, we have not said this as a mandate for the whole organization. What I'm saying is that we are looking at so many different tools, almost like a toolkit. We have looked at so many different scenarios, and for each scenario, there has to be a specific tool for that. So we're still at early days. Mind you, Ghana is only a few, like 6 to 8 weeks in. Other countries have been doing this for a longer period of time. So there's still a long way to go. So at this stage, we haven't laid anyone off. We are not intending to. At this stage, for our frontline healthcare workers, those who are actually at the emergency and those who are at the ICU, the critical care, we've actually said that we will give them a risk allowance. A risk allowance which is more than they're getting just because they're taking more risk and they're putting themselves more in contact with suspected cases. But what we have also said is that for those who are not in those front lines, can you let go of some of your salary and give that to the frontline healthcare workers? So, whereby we are community first. This is the time for family. This is the time for teamwork. And it cannot be that I'm watching out for my own, because if the organization does not survive, well, we don't have the job in the first place.
So you're drawing the line somewhere.
You have to. And this is what leadership is. Leadership is not about making the nice decisions. It's making the hard decisions that are going to help you get your outcome, which in the long term is to ensure that not only are we surviving, but we are still having an impact in our community. And for an organization that's been there for 50 years, definitely we want to be there for the next 50. And we need more indigenous hospitals, clinics, banks. I mean, we need more local content, because something like this, in terms of a pandemic, your borders are closed.
How much revenue are you losing?
I'll tell you that, we have had revenue dips as low as 75%.
And is this a Nyaho-specific issue?
And not a Nyaho-specific. I'm saying when you have fear and when you have a lot of uncertainty, people start changing their behaviors. And I think that in the very beginning stage, everyone was extremely scared. And so I would say that every day is different. I would say some days it can go as low as 75, but other days it can go as low as 40 or 30. Now, this is really the reality that's always low. It's consistently been low, at least by 30 to 40%. Now, we are working and we have to change that, because we cannot continue doing critical care services. We cannot continue doing emergency care services. We can't continue doing the things that we're doing if we don't see a changing of that. And so we have to adapt, and we are innovative. We're already using technology. So all our staff are using Office 365. So we were able to continue running our operations with people working at home during the lockdown. So only those who were clinical were actually working in the hospital. But now we are actually fast-tracking a number of innovations. So we've done a COVID-19 risk assessment tool with partners, with a technology partner called ClearSpace. That tool is actually available now, so people don't need to call. They can just do should I get tested or not? But we're also launching our virtual clinic option from next week. Now, that virtual clinic, we don't want to just have a call on Zoom. We as an organization have a responsibility to ensure patient safety, data protection, and these are the same things that we are looking at to ensure that whatever we produce or whatever we offer actually has value and protects our patients and our staff. So I think that the time for innovation and the time for fast tracking a lot of your technology-enabled solutions is now, but at the same time, you also have to reduce your costs.
Now, you have differentiated with this frontline issue. Government faces the same challenge in having to pay these incentives for frontline workers. What would be your message to the workers themselves? I mean, you are sitting at a point where you are looking at cash flow. The finance minister will be doing the same thing.
Yes.
What would be your message to the workers?
So, my message to every healthcare worker, I was an emergency physician in the UK, and working in emergency, it is stressful. But that is where I learned teamwork. That is where I realized that you cannot do it by yourself. I realized that in an emergency situation, you need the nurses, you need the orderlies, you need the porters, you need the security men, you need the police to protect you, because everyone is stressed and patients can get angry. I mean, the reality is that you need so many people that if you do not collaborate and if you don't stay humble and learn, people will make mistakes. I mean, we should realize that we are human. So we need to put in some grace. And for all healthcare workers, mistakes will happen. The question is that are we learning from the mistakes to ensure it never happens again, because a mistake in healthcare is a life lost. These things will still happen, and especially if there's confusion, let's not be hard on ourselves, but let's humble ourselves to learn. But to the government and to the finance minister, especially when you're talking about cash flow, well, you get cash, if you're a government, from taxes, and you get taxes from healthy businesses. So that's whereby you cannot look at, you have to strengthen businesses' ability to survive this and to thrive after this. Otherwise, you don't get revenue, and you as a government will have to then start making the same decisions, because you cannot always continue to borrow.
600 million Ghana cedis is going to be advanced to small businesses, to businesses generally, as a result of this COVID-19 pandemic. It's part of the coronavirus alleviation program. In your view, if you're standing as a hospital or a healthcare business, where should the priority go?
It's a tough one, because I don't have all the data. I'm not sitting where I can see all the different levers. So I'm only talking from my perspective. But what I believe is that whenever there's a crisis, I will take it from a system. You need to actually stop the leakage. You need to fix the thing that will kill you first. The thing that will kill us first is healthcare. If the healthcare system collapses, you cannot have good, healthy populations who can go to work. And especially whereby our population is so dependent on people. If these people are not healthy, they will not be able to work. And so the first level is to first close out your essential services, which is your healthcare, your security, and this is where the priority needs to go to. Now, I believe in public-private partnership, because Ghana is not, the private sector in Ghana is not all the nice-to-haves like you have in the West. The private sector in Ghana is filling an essential service, because the government alone cannot do it. So you need a coordinated approach. So my advice is to shore up your airway. So in healthcare, you say ABC, airway, breathing, and then circulation. If you treat the blood is not the first thing that will kill the person. It's actually the airway. It's actually oxygen.
Okay.
So it is not to go to the thing that is the easiest to fix. It is to start with your essential healthcare and security and all these essential services, then work your way up the line.
What are the long-term measures? And this will be our final point. You mentioned that a number of the government interventions are medium to short-term measures. What is the long-term plan that you expect to see, or the long-term move that you expect to see?
I think that's a great question, and I'm very passionate about this, because I want to leave an impact. I want to have a positive impact, and that's what drives Nyaho, and that's what drives our people. But for the country, this is the time that Ghana, as a black star, needs to be a hope that it is possible to be self-reliant in Africa. And it requires us to realize that, one, why is it that we don't have many hospitals and we don't have a lot of critical care ICUs? It's because we have not incentivized people for that. We've incentivized people for construction and real estate, and so they have tax incentives. We've incentivized people for manufacturing, and they have electricity waivers. But for healthcare, you don't have any of these. Healthcare is compromised because the real estate, they have to pay the full price. Electricity, they have to pay the full price, and especially if they're going to be doing complex surgeries, their electricity demand is like a manufacturing plant. And so if you do not give them the incentives, then it makes sense for them to be small and to remain small. So your tax incentive policies need to incentivize people to start building big hospitals, start incentivizing hospitals to be able to pay good wages so that you don't lose doctors and nurses to go outside to get a good salary to survive. You need to incentivize hospitals and local businesses to give good salaries, because if you can give good salaries, you're going to find a lot more people are going to come into healthcare, and they're going to want to stay in Ghana as compared to go somewhere else.
Especially now that the U.S. Has said that if you're a medical professional, you can come and come and offer your service.
And you know, you cannot invest in people and then they go somewhere else. That is a bad investment. And Yahoo, we have a part to play. So we are actually accredited by the Ghana College of Physicians and Surgeons to train family physicians. We realize that if we always depend on, a hospital should not have to think about the training. But if you're in a developing economy, You need to think about your training, and you need to train people, doctors who have the right mentality and the right ethics. So we are increasing our focus on education. It is not easy, but I think tax incentives is one. Two, the policy framework for private sector engagement. There needs to be a policy. Everyone needs to know what that policy. Everyone needs to know how they can engage.
Right.
Number three, technology. This is the time to leverage this booming startup scene in Ghana. I'm telling you, there's so many people, so many young people who will solve these problems if you give them opportunity. So I think that Ghana, and we can be transparent about what are we struggling with. Contact tracing. Well, can we not have an app for that? I mean, there's an app, but does it need to be a government-sponsored app? Actually, why don't you do a hackathon? Hackathons is whereby you actually throw a call out to people, and that's when you get innovative new ideas that have never been done before.
Right.
So I think that there's so many opportunities, and I'm so committed that I think that every person who's a Ghanaian is committed, because we all have family members. We don't want them to. We don't want them to die.
Definitely, we don't want them to die. It's a good point to end the conversation. Thank you very much, Dr. Tamaklo. It's always great to have you in studio. It's always great to have conversations like this where we learn about what's going on the other side of the fence. Dr. Elikem Tamaklo is head of Nyaho Medical Center. He didn't speak just for himself. He represents a group of private medical facilities actually who want to contribute more to the COVID-19 fight, and we're here to tell their story, the reality of what they do. It's exactly 15 minutes past 9. I've been promising you this all morning. I promise. As soon as I come back, we'll talk about politics and COVID. And you hear from these, my two friends, very, very good friends.
There's no way we won't have a new register. You must understand this.
Those who think that they can be dealing with one hand on trying to take unfair advantage of the elections and the other hand pretending to be putting the health first, in the end they will suffer the consequence.
That comes up immediately after this. Stay with us.
The pandemic has hit.
Do whatever it takes. It is in times like these that DSTV has you covered with key international and African news channels, bringing